Hello, this is a demonstration of the Category 2 flow in the office. What you're about to see is probably the most common procedures done in an all SOT office because most patients are Category 2. So if I was using only SOT, you would see something like what I'm about to demonstrate. Before we actually adjust the SI joint, and to do that we use blocks, we want to check a bunch of stuff. We want to check psoas muscle imbalance. We want to check the iliofemoral or true hip joint motion, and we want to balance that out. Then we want to check atlas, and I recommend also L5. And there's a couple of other things that I'm not going to demonstrate. There are separate videos on these other parts, such as trap fiber palpation and the sacral cup, but I'm going to mention that this is when I would do those. And these are all done before we actually use the blocks on a Category 2 patient. Just going to get my blocks, make them handy. So the first thing I'd like to do is check the psoas muscles, see if they're balanced. And so I'm going to do that with an arm over the head test, and it looks like this. Let me have your arms over your head, please. And I'm pulling up, and the patient is absolutely straightening her fingers out. I bring the fingers together, and I actually see a slight right short leg. In that case, it's probably a good idea for me to check the strength of the right psoas muscle. Normally, you'll find it to be weak. Lift this leg, please. Turn it out. Move it slightly away from me. I'm going to stabilize the left ASIS. Hold the leg. And she can't. So I'm going to correct this weak psoas with a psoas stretch. There's a couple of ways to do this. There's actually many ways to do this. The standard DeJarnette method is to have the patient bend the knee on the tight or weak psoas side, which is the side facing you. I'm going to take my arm, my inferior arm, and put it underneath her knee and stabilize her ilium against her sacrum. I'm going to take the heel of my superior hand and place it underneath the right rib cage. Breathe in and breathe out. Now I'm going to move the heel of my hand inferior and lateral a couple of inches and do it again. Press medial to lateral and A to P during the exhalation. And again. Now straighten your leg out. Raise the leg. Turn it out. Keep me from pushing down and out. We're looking for the leg to be stronger, and now we're looking for the arms to balance out on the overhead arm pull. The next thing I'm going to check, and I'm going to change the angle of the camera here so you can see the feet, is I'm going to check how far I can internally rotate both feet. And really that's a hip joint rotation. The vast majority of internal rotation of the leg comes from the hip joint. So I'm going to turn that foot in that far and this foot in this far. And let's just say that her right leg wouldn't turn in as far. That's an iliofemoral test. And to correct it, I stand opposite the side of the restricted internal rotation. I find the greater trochanter. I hook my fingers behind the greater troch. I lift, and she turns her leg out as hard as she can. So we're having a little bit of a soft tissue tug of war. I would repeat that 2 or 3, maybe 4 times, and then I would recheck. Now you'll find that you have much more internal rotation on the previous restricted side. The next thing I'd want to do before I went to the SI joints is I would want to check Atlas and L5. So the easiest, fastest way that I'm aware of to do this in the supine position is to place my thumbs above the medial malleolus, pull down, find the short leg. Ask my patient to keep her head on the table and tuck your chin. And if the legs balance, I would know I had Atlas. This test doesn't give me a listing, it just tells me that I need to adjust Atlas. To check for L5, I would ask my patient to lift her hips a little bit off the table, put them back down, and if she had a short leg, which she doesn't, the legs would balance. Okay? Again, it wouldn't tell me the Atlas listing, but it would tell me that the L5 listing, but it would tell me that I need to adjust L5. There's two other things that I can do. Oh, there's actually a fifth thing that I can do. Bring your arm up, please. Point your right foot down. Hold the arm. Left foot. Hold the arm. If either of those created arm weakness, we would know we had a foot or ankle issue that I would have to check out. And you guys can use any method you want. If you've had lower extremity, take a look at that foot or ankle. I'm sure you'll find fixations. You need to mobilize the foot or ankle. Pointing the foot down makes anterior misalignment of tibia, talus, or third metatarsal worse. It's not that great for determining navicular and cuboid. But midline bones, which are very, very common, this is a good test. And so then go from there and palpate and see what you find and mobilize the foot or ankle. At this point, we're now ready to determine, to block our patient. Now, we don't block all category 2 patients. And this is an important point to remember. In order to use the SOT blocks on a category 2, they must have a weak arm fossa test, and not all category 2 patients have it. And they must also exhibit UMS and LLL, which I've demonstrated in another video, probably this week or 4th week, 3rd week, or 2nd week. There is a video on the Blackboard website of UMS and LLL. You find the ASISs, get your thumbs just medial and inferior to the ASISs, push in and rub across. Ask the patient, is either side more painful? That would give you the side of U or upper. Then go to the lower medial inguinal ligament, do the same thing. You're really rubbing across the rectus abdominis. Ask the patient if either side is more painful. That would give you the first L from LLL. Then we come down to the top of the kneecap, halfway to the medial knee. My thumbs are rubbing across the insertion of sartorius tendon area, not the actual insertion. I'm at the level of the top of the kneecap, halfway to the medial leg. That's the M, or medial knee. We'd like to have U and M on the same side, and we like that to be the short leg side, upper medial short. That indicates that the patient has a PI ilium on that side. We also palpate the lateral leg. That's the iliotibial band. I rub across it. That would give us our more painful side is the L side. So if we have lower inguinal ligament and lateral leg pain worse on the same side, if that's the long leg side, that indicates an AS ilium on that side. So translating SOT category 2 blocking into what you know about full spine, UMS is PI and LLL is AS. The LLL indicator in SOT is the only pathognomonic AS indicator that I'm aware of in chiropractic, and I'm sure I mentioned that somewhere else in this set of videos. To block a patient, category 2, we use a pelvic board. It looks like this. I want the top of the board to extend 2 inches above the iliac crest of the patient. Excuse me.
Call from.
Okay. Again, iliac crest 2 inches, the top of the board 2 inches above the iliac crest, and the board goes across this way. So I'll ask my patient to bend her knees and lift her hips, and I'll find the iliac crest and I'll place the board underneath. And she can actually keep her knees bent because she's going to need to lift the 2 sides of her pelvis one side at a time so I can get the blocks in. Let's just say that Rose has a right short leg with UMS on the right. That's the side that's facing the camera. I would grab the block, I would find the iliac crest, and I would place the block underneath the ilium so that it was bisected by the iliac crest. So you don't want the iliac crest to come more than halfway up the block. Lift this hip, please. The other block is placed on the long leg side, facing up at the high block at a 45-degree angle through the greater trochanter. Lift. Great. Okay. And straighten your legs. And so that's category 2 blocking. I would then redo the arm fossa test wherever it had been weak, and when it's strong, I will take the blocks out. The average time is only 30 seconds. So your most common category 2 patient is going to be on the blocks for no more than 30 seconds. Don't block someone more than 2 minutes. Okay, that's the maximum. If their arm fossa has not strengthened within 2 minutes, it's probably not going to strengthen. And personally, I would go back to the drawing board. I think you probably made a mistake. There's a couple of other procedures I can do on a category 2 visit. I'm going to change the angle of the camera so you folks can see this a little bit better. One procedure is stair-stepping and figure 8. Which looks like this. The cervical spine, if I push the head straight towards the feet, let your head relax for a minute, please. The head will come off the table in 1, 2, 3, and 4 steps. If I can't get up a step, I will run the head through a figure 8. This is called figure 8. Figure 8 is a specific mobilization at a particular area of the spine. The first step is anterior translation, T1C7, then C6, 5, then C4, 3, then C2, 1. Wherever I feel a fixation coming up the steps is where I would move the head around in a figure 8. That's considered an adjustment in SOT, but it's not very specific. If you cannot mobilize the neck at one of those 4 steps, go ahead and use whatever kind of cervical adjusting that you would normally use. Another procedure I could do on a category 2 visit is called basic 2 cranial. I'll lift your head. I put one hand underneath the occiput. So I have that down hand like that. The heel of the other hand is here. My fingers are underneath the zygomatic processes or the malars or the cheekbones. I'll have my patient breathe in deep, suck on the tongue or the thumb, dorsiflex her feet. I'll press the heels of my hands together and press my hands towards the feet and hold for 20 seconds or so. Repeat 3 or 4 times. So what you've just seen me demonstrate is the flow of a Category 2 visit. Thank you.